Population aging in Malaysia isn't something to be mourned. Rather, it should be celebrated, as it speaks of Malaysia's public health success, which has led to longer life expectancies, declining fertility and mortality. Having said that, we need to be prepared. Prevent Elder Abuse and Neglect initiative, PEACE, is a research program that is funded by the University of Malaya Grand Challenge Program under the Wellness Research Cluster. PEACE encompasses 4 areas: research, education and training to health service providers and caregivers, community engagement programs such as public forum and health campaign. These are mainly to encourage our community to be actively engaged in issues related to older people, and finally, identifying existing laws on elder abuse, understanding these laws and refining the laws to address the gaps. Very little is known about elder abuse here in Malaysia. Elder abuse is a highly sensitive taboo subject and often remains hidden within the families. But we urgently need local information as the numbers and proportions of older people in Malaysia are increasing rapidly.
Elder abuse is actually abuse of an older person by someone they trust. It can be a single or a repeated action or inaction which can cause harm for to this elderly person. One of the activities that we have under PEACE project is an educational intervention among healthcare providers in primary care. What we have is an intervention for doctors and nurses in primary care, because it is in primary care setting that we have a window of opportunity to intervene elder abuse if it occurs among the elderly people.
Another component of our research focuses on the caregivers of the elderly. Each caregiver is unique, and so is their coping mechanism. Our team also developed a training module for the caregivers, emphasizing on effective communication skills, enhancing positive emotion, and managing stress. While taking care of the elderly, it is important to cater for their physical needs as well as their emotional and spiritual needs. It is our main intention to create awareness among caregivers of their role and empowering them to handle older persons with dignity. Hand in hand, we can all help prevent elder abuse and neglect.
Emerging evidence have suggested that elder abuse and neglect is a universal phenomenon. Recently, our research center, Julia Center, University of Malaya, in partnership with Queensland University of Technology and Cochrane Public Health, had published a review identifying specific programs or strategies that are useful to prevent or reduce elder abuse. In our study, we actually found that there is a lack of robust evidence to suggest which type of elder abuse prevention program really work or do not work in reducing or preventing the occurrence of elder abuse. Right now, we are certainly in dire need of focused, high quality and well-funded elder abuse prevention research.
We argued that in relation to elder abuse and neglect, and in the light of Malaysia being an aging nation by 2035, it is important that elder abuse and neglect must be addressed. We can address this issue via 2 approaches. One, to just simply opted for a piecemeal amendments by amending the existing statute, or 2, by coming up with a more holistic and specific elder statute for the elderly specifically.
Every person, no matter how young or how old, deserves to be safe from harm by those who live with them, care for them, or come in contact with them. We hope that the results from PEACE will improve policies and the practices of prevention and management of elder abuse and neglect in Malaysia.